Code followed.
Your passcode.
Welcome, and thank you for standing by. All participants have been placed on listen only until the question and answer session of today's conference call. Today's call is being recorded. If you have an objection, please disconnect at this time. I am Loretta Jackson Brown, and I'm representing the Clinician Outreach and Communication Activity, COCA, with the Emergency Communication System at the Centers for Disease Control and Prevention. We are delighted to welcome you to today's COCA webinar, Leptospirosis in the Pacific Northwest. Is this the tip of the iceberg? COCA is excited to offer this special call series with our COCA partner, the American College of Veterinary Preventive Medicine. We are pleased to have with us today Dr. Sharon Grizel here to discuss leptospirosis reemergence in the Pacific Northwest. At the conclusion of today's session, the participant will be able to describe the evidence of reemergence of leptospirosis in the Pacific Northwest, discuss the factors that contribute to difficulty in diagnosing leptospirosis, describe the demographics of dogs that are at risk for leptospirosis in the Pacific Northwest, and compare and contrast current and past evidence of risk for infection in dogs and humans, risk and benefits of vaccination of dogs, and risk of adverse vaccine events. In compliance with continuing education requirements, all presenters must disclose any financial or other association with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of an unlabeled product or products under investigational use. CDC, our planners, and the presenters for this presentation do not have financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. This presentation does not involve the unlabeled use of a product or products under investigational use. There was no commercial support for this activity. At the end of the presentation, you will have the opportunity to ask the presenter questions. On the phone, pressing *6 will unmute your phone. You may submit questions through the webinar system at any time during this presentation by selecting the Q&A tab at the top of the webinar screen and typing in your question. This will place your question into the queue. Today's presenter, Dr. Sharon Grizel, is an associate veterinarian at Columbia Veterinary Center in Vancouver, Washington. She earned her doctorate of veterinary medicine from Tufts University School of Veterinary Medicine and a master's in public health from the University of Iowa College of Public Health. She became a diplomate in the American College of Veterinary Preventive Medicine in 2011. Dr. Grizel is an infectious disease researcher with over 20 years of experience in small animal medicine. Her most recent project is a study on canine leptospirosis on behalf of the Oregon Health Authority. She has been presenting the results of her research and sharing her recommendations with small animal practitioners throughout the Pacific Northwest. At this time, please welcome Dr. Grizel.
Hello, everyone. This is Sharon Grizel, and I want to talk to you today about the research that I've done on canine leptospirosis, primarily in Oregon, but I'm going to talk a little bit more generally about the Pacific Northwest, and I hope that it is enlightening and also has some relevance to you. So leptospirosis is the most common and widespread zoonotic infection in the world. It's not a disease that we've been focusing on necessarily in the United States, but it is considered reemerging in some parts of the United States, both in dogs and in humans. And dogs are an important species to study because they are key to understanding the ecology of this disease, both as a sentinel species for the disease in humans, but also as a bridge between wildlife, domestic animals, and humans. Leptospirosis was viewed as a declining disease in the 1970s into the 1990s. It stopped being a nationally notifiable disease for humans in 1994, and at that point there was some loss of data in terms of what was going on for leptospirosis among humans. It remains notifiable for some states, and some states also require veterinarians to notify about cases of animal leptospirosis. So in the early 2000s, it appeared that it was reemerging both in dogs and in humans, and there's evidence for that. So just to give the human picture, there are between 100 to 200 human cases per year in the United States. About half of those are diagnosed in Hawaii. In the Pacific Northwest, we see in Washington between 0 to 5 cases per year, and in Oregon between 0 to 2 cases per year. So not a lot of cases of human leptospirosis are diagnosed in the Pacific Northwest, and I'm going to talk a little bit about the reasons for that, as well as what might be happening in the future. So is this the whole picture? Do we see all the cases that are out there? And the answer is definitely no. And why are cases missed? Well, one of the first reasons is that up to 85% of cases, both in humans and in dogs, are either mild or subclinical infection. And those cases are probably not likely to be seen either by veterinarians or by human health care providers. So there are cases out there of infections that are never going to be identified. Beyond that, even in those cases that are either moderate or severe illness, the clinical signs tend to be nonspecific, and so they can be missed, especially when there is a lack of clinical suspicion among healthcare providers. So unless a veterinarian or a clinician, human clinician, is thinking about this disease, they're not likely to test for it or diagnose it. So that leads to some misattributions of diagnoses. For example, during the 2009 pandemic H1N1 infection outbreak, at least 3 cases of severe leptospirosis occurred that were identified later. They had originally been attributed to H1N1, but when those patients actually were assessed, they were not diagnosed with H1N1, and they were able to diagnose leptospirosis in those patients. And those patients were in Missouri and in Florida. In 2001-2002, Hawaii had an outbreak of dengue, and during that time, there were a large number of patients that were diagnosed with dengue, but there were about 1,200 patients for which an initial diagnosis of dengue was made, but the laboratory testing did not confirm that diagnosis. And when they went back to look at those 1,200 patients, they did testing and found that 54 of those, or 4.5%, actually turned out to be diagnoses of leptospirosis. So leptospirosis hides in other diagnoses or potentially doesn't get diagnosed at all. Then there's the issue of passive surveillance versus active surveillance. So because this is a disease that has such nonspecific signs, in years in Hawaii in which there was 1 year in which they did a project and did active surveillance for this disease, and that was in 1998 to 1999. And during that 1 year, they diagnosed 5 times as many cases of leptospirosis as they did in other years in which passive surveillance was being used. So the need for real clinical suspicion and going out and looking for these cases is really there, and otherwise cases are missed in large numbers. So going back just to give a little background and get everyone caught up, there are over 200 different pathogenic serovars of leptospirosis. 12 of those are pathogenic for dogs, and 6 of those are responsible for most of the illness in dogs in the United States. And historically, Leptospira canicola and Leptospira ictohemorrhagia were the most important. Those two serovars are less important now, partly because of the vaccine that has been available for decades now that prevents those infections. But now we're seeing more infection with Leptospira pneumoniae, Leptospira grippotyphosa, Leptospira autumnalis, and Leptospira bratislava. And I'll talk a little bit about Leptospira autumnalis later on because that one has a slightly special case, and it's hard to know exactly what's going on with that one. Each serovar is maintained in a reservoir host, and it's important to remember that reservoir hosts, while they can harbor the organisms for life, the same species can also be infected and show disease with those same serovars. But the reservoir hosts range from wildlife to domestic animals to marine mammals. And among the wildlife, we see it both in urban wildlife, such as rats and raccoons, but also more rural wildlife. So it really has a range of environments, both urban, suburban, and rural. Routes of infection are both indirect and direct. The indirect route is more common, and it is through abrasions of the skin or mucous membranes and then contact with urine or contaminated water, soil, food, or bedding. Direct infections also possible through bite wounds, ingestion of infected tissue, for example, wild animal carcasses, and venereal and transplacental transmission is also possible. So what's the evidence for leptospirosis in the Pacific Northwest? The evidence comes from a variety of sources, and I'm going to just kind of run through that and lead up to the study. So in 2008, there was a national study looking at submissions to IDEXX laboratories for leptospirosis for dogs, testing for dogs. And that study examined over 31,000 submissions across the country, and they identified Oregon as a geographic focus for leptospirosis both in 2004 and then again in 2007. And this next slide shows the map of one of their maps where they found foci of leptospirosis. So even though I'm talking about the Pacific Northwest, if you take a look at the map, the red dots are locations where they found leptospirosis, and they identified different areas of the country, including down into Northern California, Texas, in Colorado. They had focus in the Midwest, both in the Chicago, Detroit area and into Ohio, mid-Atlantic states, and then northern New England. So their leptospirosis in their study was emerging, or they saw foci in different parts of the country. And just as an aside, I wanted to point out that we talked about Detroit as a hot spot from that study. In 2011, this is from ProMed, there was a report of an outbreak of more than 20 cases of leptospirosis in dogs within a 3-week period in the Detroit area. So outbreaks are certainly possible even when leptospirosis is reemerging and is in a more low-level background, seeing cases over time. There can be outbreaks as well. So getting back to the Pacific Northwest now, there was an outbreak in Washington State in 2004 to 2006. They were seeing high numbers of canine cases, and 3 human cases were associated with that outbreak or increased incidence in dogs at that time. And during that time, some of the researchers in Washington decided to do a study looking at serology, both of healthy dogs and injured raccoons. They found positive titers in 17% of the healthy dogs they tested and 19% of the injured raccoons. So at least exposure among those animals. This comes from a survey of leptospirosis in rats in Multnomah County, which is the Portland, Oregon area, between 2008 and 2011. And in that study, almost 14% of rats tested by PCR tested positive for leptospirosis. And this is a interesting statistic because in Portland, as in other urban areas, rats are pretty prevalent, and they're estimating 10 rats per person in Portland. So there's a big population of rats in Portland, and potential contamination in the environment is pretty high. Some more evidence of leptospirosis in the Pacific Northwest and in Oregon came from a study that was done along the Oregon coast. In 2009 and 2010, there was a dramatic increase of leptospirosis among California sea lions. They saw in each of those 2 years 3 times as many sea lions being stranded as had ever been recorded previously. So they began to do necropsies on these animals, and they found in 2009 that of the kidney samples that they tested by PCR, 44% were positive for leptospirosis. In 2010, number was 71%. The number that they tested was pretty small, but they had quite a few animals that were testing positive for leptospirosis. And then in Washington in 2010, a report from there talked about increases in leptospirosis cases. They identified 29 cases in western Washington, and that was a significant increase over the previous year. They were seeing those cases primarily in western Washington, and they were seen in the fall. And we'll talk a little bit about that in a few minutes when I get into my study, talking about both the geographic distribution and also the temporal distribution of the disease. So this is from the study that we did. We looked at canine leptospirosis and tried to identify all of the cases in a 5-year period from 2007 to 2011. We identified cases from a variety of sources, and those included the voluntary veterinary reports that began in 2005 in the state. There were also voluntary laboratory reports from 2007 to 2009. And then beginning in 2010, laboratory reports became mandatory for leptospirosis, and we had those mandatory reports in 2010 and 2011. From those first identifications, there was a telephone survey that we did to follow up with veterinarians who had managed the cases of leptospirosis. And we conducted 62 interviews, and of those, 36 cases were identified as being leptospirosis, either definitive or probable cases. And from those 36 interviews, we were able to gain additional information that wasn't available in the reports and to get a better picture of demographic factors, outcomes, clinical presentation, and that sort of information. So the total for Oregon in terms of number of cases for the 5-year period from 2007 to 2011 was 113 cases, and 94 of those were definitive and 19 were probable cases. And I want to just talk a little bit about the case definitions that we used, and then how we looked at the different testing. So the case definition was any dog with a clinically compatible disease and a positive PCR test for either blood or urine. If we were looking at the microscopic agglutination test, which looks at serology, we looked at unvaccinated dogs with a titer of either equal or greater than 1 to 800 as a positive case. We also define cases as those dogs who had a 4-fold increase in paired serology, so 2 weeks after the first MAT test, repeating that test. And then if the dogs had been vaccinated in the previous year, we looked for a titer of equal to or greater than 1 to 3,200 for vaccine serovar, or equal to or greater than 1 to 1,600 for non-vaccine serovars. And I just want to talk a little bit about the testing. The microscopic agglutination test is the test that has been around for quite a while and has been in common use. It does look at serology, and it does look at it based on different serovars. So a very high titer indicates an acute infection, and the serovar with the highest titer is accepted as the infecting serovar. If you don't have a very high titer, then you must do a convalescent titer in 2 weeks, and you're looking for the 4-fold rise in titer to confirm the infection. And some of the issues with this test are cross-reactions, especially for Leptospirosis autumnalis. There are also issues about safety for laboratory personnel because they are working with live antigen leptospires in order to run this test. And there can also be issues about cross-contamination of the tests. So this test can be very useful, but it also can be somewhat difficult. The other test that is commonly used now is polymerase chain reaction, and that advantage of that is that it can be done earlier in the infection because it doesn't require an immune response. So blood or urine should be collected before antibiotics are started, and any positive is considered a confirmed case. And tests can also be done on post-mortem samples such as kidneys or liver or other samples. Results come back very quickly, and that's important, of course, for public health issues, both for the managing veterinarian and staff, but also for owners and then for the public as well. And the only thing is it doesn't provide any information about serovars, so in terms of epidemiologic investigation, it's not quite as useful as knowing which serovars are infecting animals in the area. So here's the graph of our cases by year, and I want to talk about that a little bit. In 2007, we knew from the study that was done in 2008, that was the national study, that Oregon was a focus for leptospirosis, and our numbers did verify that. That was the year with the highest number of cases that we identified. And those numbers seem to fall off into 2009, which was the lowest number of cases. But we're seeing cases all across the board in every year, and those numbers started coming back up in 2010 and 2011. And even though it wasn't included in the study, in 2012 there were 26 cases in Oregon, so even more cases than were seen in 2010 and 2011. So why do I call this the tip of the iceberg? We talked about it a little bit before. What's really going on, and what's the issue for dogs? Because that's what we were looking for in that study. What's happening with dogs in Oregon for leptospirosis? So the reason I call it the tip of the iceberg is because probably at most we're seeing 10% of the cases that are out there. 90% or more are not being identified, and 85% of those infections are either mild or asymptomatic, and so those are not ever likely to be identified because they're probably not going to be seen by a veterinarian, or if they are, they may not trigger that sort of testing right away. So of the 15% that have moderate or severe illness, there are a variety of reasons that they may not be identified. Some may not be brought to a veterinarian. Some of those will be tested, but the test could be equivocal either because of the timing of the test or because of a lack of a convalescent titer doesn't confirm the diagnosis. Some of those patients won't be tested either because of the lack of clinical suspicion or because the client declines the testing. And then finally, some of those may not be reported, though that's less likely with mandatory laboratory reporting. So how do we identify those missing cases, and how do we help veterinarians understand what cases are out there that we're missing? What are the trends that are going on in Oregon cases, both seasonally, geographically, the demographics for the patients, What are the clinical presentations that veterinarians should be thinking about? And then what are the outcomes for those cases? And we looked at all those factors. So the first thing was going back and thinking about how is this going to be distributed in the state and how is it going to be distributed throughout the year. And this goes back to a rainfall pattern for leptospirosis that says that there's increased cases following increased rainfall. And that, of course, is most dramatic when there's flooding, and that's when outbreaks are seen. But even when there's not flooding, there have been studies that show that leptospirosis cases rise 3 months after the highest rainfall. So the incidence is likely to be the highest then. And also in the rainfall pattern for the state of Oregon, we have a state that is very wet in the western part of the state, very dry in the eastern part of the state. And so we were looking to see whether cases also followed that pattern. And just to make it more generalized, Washington State also has the same geographic boundaries for its cases of leptospirosis, or rather for its rainfall patterns, and probably for its cases of leptospirosis as well. They do report most of their cases in the western part of the state, which is the rainy part of the state. So this is a map of leptospirosis in Oregon by county. And taking a look at this, we do see most of the cases in the western part of the state. The darker blue that's in the north part of the state, that's the Portland area. And so we do see more cases in the more geographically dense areas as well, but we see cases throughout the western part of the state. Taking a look at the eastern part of the state, we don't see any cases really. And I have the average precipitation for Oregon on this next slide. And if you take a look at it, the cases in the previous slide really mimicked this slide very well. So it does follow that rainfall pattern theory. We also looked at rainfall by month for Western Oregon, just choosing a variety of locations. And Oregon is different from other parts of the country in that we have a very mild winter. We actually see the highest precipitation in December and January, and that is mostly rain. At least we don't have a lot of snow in this part of the state, or actually most of the state except for in the mountains. So looking at that, we would expect, if we're following that 3-month period, that we would see most cases in the spring. And that is true in our study. We saw the highest number of cases in March and April. And that differs quite a bit from other parts of the country where leptospirosis is most commonly reported in late summer and fall. The thing to notice here, of course, is Western Oregon, we have rain for 10 months of the year, significant amounts of rain for 10 months of the year, and we did see leptospirosis in every month of the year in our study. And we saw it, the most cases in the spring, but also late fall into early winter had a lot of cases as well. So thinking about the demographics of dogs, traditionally the picture for leptospirosis in dogs has been that dogs that are at higher risk are male dogs, especially intact males that are considered more likely to roam. Rural dogs, dogs large or working dogs, and then young adult to middle-aged dogs. So is that supported by our study? I'll go through what we found and kind of talk about whether this picture is really what veterinarians should be thinking about when they're thinking about leptospirosis. So by sex, we found that we had 60 male dogs in the study and 48 female dogs. So a pretty good number of female dogs, not a big difference between males and females for the cases in Oregon. Thinking about dogs by size, we found that large breeds, and we defined that as dogs in breeds that were over 60 pounds, accounted for approximately half of the cases, but that meant that half the cases were in dogs under 60 pounds, and the small dog breeds we defined as under 30 pounds, those were approximately a quarter of the cases. So a lot of times when veterinarians are thinking about dogs at risk, they're discounting the very small dogs as being less likely to be at risk, and they are less likely than the large dogs, but they still account for a good percentage of the cases in our study. We looked at the dogs by age, and the only group that really didn't have very many cases were the very young dogs, dogs under 2 years of age. We only saw 6 cases in the 5-year period. But dogs across all other age groups were at risk, and we did see cases in pretty good numbers for those. And then finally, we asked veterinarians about the home setting of the dogs that they had diagnosed and defined those as either rural or non-rural. They're living in urban or suburban environments. And those were equally divided among the rural and non-rural groups. So not just rural dogs are at risk, but also dogs both in urban and suburban settings are at risk for leptospirosis in Oregon. And that makes sense in this state because, and probably in many other locations as well, as there's more encroachment of wildlife into backyard habitats, as people take their dogs farther, either hiking or just out on walks. We have a lot of opportunities for exposure for dogs, even those living in suburban and urban settings. So the conclusion that we came to was that for Western Oregon, the entire canine population is at risk. You can maybe argue that very young dogs were not as high risk as other dogs, but really across the board we were seeing dogs in every category being infected with leptospirosis. We asked veterinarians about vaccination history for their patients, and of the 36 cases that were surveyed, there was only one dog that had been vaccinated in the previous year. So hard to know whether that dog was infected with a non-vaccine serovar because that dog was tested by PCR and not by the MAT test, or whether this was a vaccine failure. But we were not seeing a lot of dogs that were current on their vaccinations that were becoming infected. So thinking about the exposure risks, exposure to water we talked about, so swimming, wading, or contact with surface water is considered an exposure risk. Contact with wildlife or dead animals, roaming, just because they will have more contact with water or wildlife in those situations, contact with ill animals, and then travel. And we asked veterinarians about their patients and about the history that they were able to gain from owners. So when veterinarians went back and looked in the history for any a history of exposure, there were some veterinarians who were able to identify some of these, but we found that 58% of patients had no identified exposure risk factors in their history or in the memories of veterinarians who treated them. So there are owners out there whose dogs are being exposed and who don't have any awareness of that exposure risk. We asked veterinarians about the clinical presenting signs that they saw with their patients, and the most common clinical presenting signs were very nonspecific. Lethargy, anorexia, vomiting were top the list. And then followed by fever and diarrhea. So all clinical signs that can be seen in many different illnesses, and getting down to where you might consider either renal or hepatic failure into the polyuria, icterus, or polydipsia, those patients presented with signs consistent with those issues only in 11 to 13% of patients had those signs. So really thinking about this, it's not going to come in as necessarily a presentation that's going to be consistent with liver failure or kidney failure. And this matches up with a study that was done at Cornell at a referral hospital, where they also saw that the most common clinical signs were those nonspecific signs, lethargy, anorexia, and vomiting. And they did see some signs that we did not see, weight loss at 30% of patients and PUPD in 30% of patients. I think that that's probably because these patients were seen farther into the course of their disease because they were at a referral hospital, and most of the cases that we were identifying were seen at the local practicing veterinarian hospital. So testing. In order to be able to test, you have to have a clinical suspicion that that illness is present. And as I just mentioned, those signs are nonspecific. Once they start with blood work, they may see mild elevations of liver enzymes. They may see increases in a BUN or creatinine. Sometimes there may be thrombocytopenia or other hints that will direct veterinarians to test for leptospirosis. But as I went through the study, one of the veterinarians I spoke to had 8 cases in a 16-month period. And so I asked him, what happened there? What's going on that you're seeing 8 cases? Because most of the other veterinarians I spoke to had diagnosed either 1 or 2 cases in the 5-year period. So I asked him about it, and he said in the summer of 2010, he had gone to a talk on leptospirosis. And then in the fall of 2010, he had a dog that presented. She was a Bichon Frise, so a small dog, and she presented with nonspecific signs, lethargy, vomiting. She had a fever, and she had mild elevations in her ALT. And he decided to test her, and that test came back positive. She was the first positive test he had had. So that was such a surprise to him because he was expecting it to be a negative that he started testing many more patients. So over that 16-month period, he tested 48 animals, and of those 48 animals, 8 were positives. So those were all cases that prior to 2010, he wouldn't have tested. So that really highlights how leptospirosis has to be in a clinician's mind in order to arrive at that diagnosis. We asked veterinarians about the outcome for their patients, and we found that most of them, 69%, fully recovered. But there was a 17% case fatality rate, so that's a pretty dramatic number of patients who are not surviving this illness and are either being euthanized because of the illness or died as a result of the illness. So these animals are very ill when they're being treated, and it's possible that some of the animals that are less ill were just not even seeing those cases or not identifying them. We looked at the predominant serovars for leptospirosis in Oregon, and we found that Leptospira autumnalis was the one that was most commonly identified. And that is sort of an interesting finding because that is the serovar that is most commonly known to cross-react with other serovars in the testing. So it's really hard to, give credence to that high number of Leptospira autumnalis because some of those potentially can be infections with other serovars. But of the other serovars that were found, all of them were seen, and Leptospira pomona was the next most commonly seen. And I just wanted to point out that of these cases that we identified, 41% are vaccine preventable with the vaccine, the 4-way vaccine that is available now. And potentially more than that could be vaccine preventable because we really don't know with the Leptospirosis what the true serovars are for that one. So issues with interpreting the serovars. There's a human study that was done looking at the concurrence between the MAT serovar testing and cultures of samples, and they found only a 46% concurrence between those two tests. So the MAT definitely has some issues in terms of identifying the serovars. There's definitely considered to be cross-reaction between serovars on the MAT testing. And despite that cross-reaction in testing, it's not thought that there is likely to be cross-protection for the vaccines. So even though we see that, and some people suggest there may be some cross-protection for vaccine, that hasn't been demonstrated yet. Still, for preventive measures for this disease, vaccination for dogs is probably the best preventive measure. There has been some resistance to the vaccine because historically it was thought that this was a vaccine that caused more adverse reactions in dogs than other vaccines. But looking at the newer vaccine, studies have not shown an increased risk for vaccine reaction when they're compared with other vaccines that are available for dogs. So, and that came from the ACVIM consensus statement on leptospirosis that was put out in 2010. And part of their statement, and I'm going to just read this quote, was that in geographic locations in which infection occurs in urban backyard dogs, all dogs may be at risk, and the vaccine may be considered part of a core vaccination protocol. So at least for the Pacific Northwest, in western Oregon, western Washington, and other parts of the country as well, where dogs are at risk across all sorts of demographic groups, it may make more sense to include this vaccine as standard for most dogs and then talk about which dogs should not receive it based on their specific medical history or risk factors. And the other piece of this is that for the vaccine, it does need to be done annually. So other recommended preventive measures, minimizing contact with potentially contaminated water. That photograph there is my dog, and as you can see, he loves the water. He spends a lot of time in the water, and I think I would have a really hard time keeping him out of the water, especially here in Oregon where there's pretty much a puddle outside all the time, and he comes in contact with water frequently. So it's great theoretically. It may be very difficult to do practically since dogs are going to, even in urban areas, be walking through puddles and other areas that potentially are exposures for them. Then also minimizing contact with wildlife and animal carcasses. That definitely is something that should be encouraged and emphasized. And in light of that, excluding wild animals from home environments, especially eliminating rats and other pests from home environments, and trying to keep wildlife out of backyards and other environments where they may contaminate the soil or the water. So as far as public health considerations go, dogs are considered a good sentinel species for human infection, and so they can be used as a gauge for where human infection may be going. They also have the potential for zoonotic transmission, so that's something to keep in mind as well. And as far as being a sentinel species, the Washington outbreak that was seen in 2004 did correspond to that increased human infection in 2005. So that the human cases did follow after that increase in incidence in 2004. In terms of other considerations, veterinarians and staff need to be aware of this, both in terms of having that clinical suspicion to test and diagnose this disease, but also to protect themselves and use personal protective equipment for patients that are hospitalized that potentially have leptospirosis. Owners need to be educated about the zoonotic risk because zoonotic transmission does occur, and it can occur from not just from dogs to people, but also from pet rats. There have been documented cases of pet rats transmitting leptospirosis to their owners. In terms of the general public, more leptospirosis in wildlife and dogs means more potential exposure, more contamination of the environment. So backyard wildlife, it means that potential for gardening exposure is there. Recreational exposure is there in terms of water sports. Occupational exposure is a potential for those occupations that are dealing with water or muddy situations. And then, as I mentioned, backyard contact with wildlife. So in conclusion, leptospirosis is present in Oregon. It appears to be reemerging in dogs. And we have not seen the evidence yet of increased cases in humans, but we consider any dog in Western Oregon to be susceptible and at risk. And dogs may be, a good sentinel for human cases in this part of the country and other parts of the country as well. So that's something just to keep in mind, that as we start to identify and see more cases in dogs, we may also see more cases in humans. But it requires that clinical suspicion both in veterinarians to identify those cases, but also in human healthcare providers to have that suspicion and to do the testing for diagnosis. So I thank you for listening to the presentation, and I'd be happy to take questions.
Thank you, Dr. Brezel. We will now open up the lines for the question and answer session. You may submit a question using the webinar system by clicking on the Q&A tab located on the top bar at the top of the webinar and then typing in your question. To ask a question on the phone, please press *6 to unmute your line, state your name, and then ask your question. Please take note that we may have other people asking questions simultaneously because we don't have a way to determine who is in the queue. So please be cognizant to kind of listen and make sure someone is finished asking a question. So we'll take a moment to see if we have a question from the phone. And while we're waiting for questions from the phone, we have a question through the webinar system, Dr. Brezel. And the question is, what do you think are your primary wildlife reservoirs?
Okay. So the primary wildlife reservoirs, I definitely believe that raccoons are an important reservoir. Rats have to be on that list in terms of reservoirs that we identify or see. And I don't know if everybody can see the slide that I just clicked onto. Does that show up for you?
It does show.
Okay. So going back to this slide, which shows the maintenance hosts, the most common wildlife reservoirs in urban areas, probably the rat is one of the more important ones, and the rat carries the leptospira icterhemorrhagia. But I think also that in suburban and in all areas, suburban, urban, and rural areas, that skunks are going to be very important. In areas where opossums are prevalent, that may also be an important species for reservoirs. And then skunks are also, I'm sorry, did I mention that already? Skunks are also an important reservoir. And there are also domestic animals that are reservoirs, including pigs especially. And I know in areas where feral pigs are an issue, that can definitely be a reservoir host and a potential contamination of the environment. So if you're in an area of a country where feral pigs are an issue, that I think is an important reservoir.
Thank you, Dr. Griselle. Again, if you would like to ask a question on the phone, press *6 to unmute your phone. And while we're waiting to see if we have any questions on the phone, we have another question through the webinar system, and the question is there a role for drug prophylaxis in pets? If so, when is it recommended and what drug?
Okay. I didn't really talk about treatment either, but so in cases where leptospirosis is identified and being treated, the treatment of choice is doxycycline for a 2-week period. And for those patients that are hospitalized with leptospirosis, the recommendation is for prophylactic use of doxycycline for a 2-week period for any other dogs in that household as well. So, that is a use of prophylactic antibiotic. But in terms of over a longer period of time, for example, when exposure is a potential, really vaccination is the better way of protecting them rather than using prophylactic antibiotic.
Thank you, Dr. Griselle. Another question through the webinar system. Have there been any human studies that parallel some of your study questions as related to human cases in the Pacific Northwest? For the Pacific Northwest, the number of cases that are seen in humans remains fairly low. As I mentioned, most years in Oregon, there are between 0 and 2 cases per year, and in Washington between 0 and 5 cases per year. So I don't know of any study that has looked at human cases for the Pacific Northwest to parallel what we did in dogs. So no, I don't know of any studies. Thank you. How is climate change likely to affect the incidence of leptospirosis in the United States?
So there are some predictions about leptospirosis increasing in incidence in the United States as a result of climate change, and that's because increased temperatures will favor survival of leptospires in the environment, and so there'll be a longer period of time that those leptospires will be viable. There also may be more extreme weather changes or weather events, and that can lead to more flooding, and which may increase incidence of leptospirosis and potentially outbreaks of leptospirosis. And then I would say finally that changes in wildlife may occur with climate change in terms of both wildlife survival and also on encroachment into human environments, and so that may also change how leptospirosis is distributed and may increase the incidence.
Thank you. And again, if you would like to ask a question on the phone, *6 will give you access to our presenter today.
Sharon.
Yes.
This is Kelly Vest. I was interested in your slide that showed the age differences and that you had few cases below the age of 2 years.
Mm-hmm.
Were you able to identify whether there was any correlation with vaccination at that age?
No, I haven't been able to correlate. That would be a really interesting thing to go back and try to follow up with those, veterinarians who treated those young animals. But I did not have any correlation data for that. And part of that is because of the 113 cases that were identified total, only 36 of them were part of that survey.
Right. It just seems to me that you would, if you had, your younger animals that tend to be much more vaccine compliant versus the older ones, and as they get older, they may miss vaccinations or may become less immune.
Yeah, I think that's a really good thought. That makes a lot of sense. That would be one of the reasons that in those early years, those dogs maybe are not becoming infected because they are protected with a vaccine.
I had one other question concerning your rural communities. Did you find, as far as these animals, when they're just rural, were they defined as being on like a farm or agrarian society, or were they just?
Sure. Part of it was if they lived on a large property and they lived outside of town. So basically, if they were in a town with a substantial population, we considered them to be in the suburban category, even if they lived on, a parcel that was an acre or whatever. But if they lived outside, on a rural road or on a larger property, then we considered them rural.
But you didn't know whether or not they were exposed to farm animals or large animals.
No, that was not. Well, I'll take that back. We did ask if they were exposed to, what other animals were they exposed to, but not specifically to what farm animals they were exposed to. So you're right, that was not a question that was asked.
And then I had one last question. I mean, you used the MAT test, and you said you also use PCR too?
Yes. So PCR is, I guess in the earlier years of the study in 2007, 2008, the PCR wasn't widely available yet. In Oregon now, Oregon State University Veterinary Diagnostic Lab is offering PCR, and for the not last year, but in 2011 and again this year, there's funding so that the testing is actually free. So there's incentive for veterinarians to send to encourage testing and to try to identify more cases.
So are we making an assumption that if you're seeing a clinical case, I mean, as far as clinically apparent in the animal, then you would possibly, I mean, you're assuming that they are carrying the organism?
I'm sorry. Could you ask that again?
Okay, I'm sorry.
That's okay.
So I mean, as far as, I mean, how early in the disease would you actually need to be able to test that animal in order to be able to be PCR positive?
Okay. So with the PCR testing, the test is positive almost immediately in the course of the infection, though it has to be able to pick it up in that sample. So the leptospires, when an animal is infected, they start to reproduce quickly in the blood. And so early on in the course of the infection, the test will be positive for PCR for the blood sample. It's later in the course of the infection that it will become positive for the urine sample. So there's a window there. They usually consider the first week to be a good time for testing of blood. The second week is more likely to pick it up in the urine. And so that's why when the PCR testing is done, both samples are submitted, and a positive for either one is a positive result.
Thank you.
Do we have anyone else waiting on the phone to ask a question?
This is David. I just got a comment. Sharon, you said the bar so high. Thank you so much. Good job.
Well, thank you.
Okay, we have another question, Dr. Grazel, through the
Yep.
webinar system. Is there a rapid diagnostic test, for example, bedside clinician-based, such as a dipstick test that may be of use in animals? These are available for humans and can be useful at the clinic level.
Mm-hmm. So there is an ELISA test that has been used. The sensitivity is considered pretty low in that test, and it has not been used commonly in veterinary medicine, to my knowledge. That more commonly veterinarians are sending those tests out to laboratories.
Thank you. Do we have anyone else on the phone waiting to ask a question? Okay, so if we do not have any further questions, then I want to thank you at this time, Dr. Grizel. On behalf of COCA, I would like to thank everyone for joining us today with a special thank you to our presenter, Dr. Grizel. If you have additional questions for today's presenter, please email us at coca@cdc.gov. Put February 26th, COCA call in the subject line of your email, and we will ensure that your question is forwarded to the presenter for a response. Again, the email address is coca@cdc.gov. Free continuing education credits are available for this call. Those who participated in today's COCA conference call and would like to receive continuing education credit should complete the online evaluation by March 12, 2013 using course code EC1648. For those who will complete the online evaluation between March 13, 2013 and February 11, 2014, use course code WD1648. All continuing education credits and contact hours for COCA conference calls are issued online through TCE Online, the CDC Training and Continuing Education Online System at www.cdc.gov/TCE Online. To receive information on upcoming COCA calls, subscribe to COCA by sending an email to coca@cdc.gov and write subscribe in the subject line. Also, CDC launched a Facebook page for health partners. Like our page at facebook.com/CDC Health Partners Outreach to receive COCA updates. Thank you again for being a part of this special call series. Have a great day. You may disconnect at this time.
Thank you.